Hi dear friends, welcome back to our informative video on ip-drg training. Today we will be delved into the vital world of PO indicators, their significance in the regulatory compliance, their definition and why they matter. We will explore how these one character indicators play a crucial role in quality of care, patient safety and reimbursement accuracy. Additionally, we will discuss the different PO indicator options and example to help you grasp their importance in medical coding. So let's get started and gain comprehensive understanding of PO indicator for better healthcare management coding. According to the Deficit Reduction Act of 2005, mandated that the providers report PO indicators for all diagnoses submitted on Medicare inpatient acute care claims for discharge beginning October 1st, 2007. Before delving into the extensive explanation, let's establish the definition of present on admission indicators. These are the concise one-character indicators that categorize diagnoses according to their status at the time of admission. Anything that occurred or existed before admission is classified as a present, while condition that is manifest after the admission are designated as a not present. This definition is straightforward and self-explanatory. Why PO indicator is important to report on principal and secondary diagnosis? It is directly impacting on the quality of care and patient safety. Proper documentation and coding of PO conditions are essential for tracking and improving the quality of care and patient safety. It helps hospital identify area where the hospital acquired condition may need attention, ultimately contributing to improved patient care. Accurate reporting of the PO indicator for both principal and secondary diagnosis code is of significance important for quality of care reporting and analysis. If the PO indicator is missing in the claim, it can have significant consequence for the reimbursement and processing of that claim. If the context of ip-drg inpatient prospective payment system coding and hospital reimbursement, the absence of valid PO indicator can result in various outcomes that including potential rejection. Some payers such as Medicare may reject claims if the PO indicator is not properly documented. They require accurate reporting of whether a condition was present on admission to determine the appropriate payment. Payment reduction. In some cases, the absence of valid PO indicator may lead to reduce the payment for the claim, as a certain condition might be considered as a hospital acquired condition or comorbid condition and payment can be adjusted accordingly. Missing PO indicator can lead to audits and reviews. Claim without valid PO indicator may subject to audit reviews by payer or regulatory bodies to ensure proper coding and reporting. This can result in the delayed payment and additional administrative burdens. Administrative hassles. The absence of PO indicator may lead to administrative complications such as appeals, resubmissions, or additional documentation requests. To avoid these issues, healthcare providers and coder must ensure that the PO indicator is accurately documented in the medical records and properly reported in the claim. This is essential for accurate reimbursement and compliance with the healthcare guidelines. Hospital care quality and efficiency can be measured by the number and severity of conditions that happen on their watch, and because it can greatly affect the reimbursement of facility service. There are quality measures and other payment provisions forbidden or lowering payment for some diagnoses if they happen after admission. CMS and most of the third-party payers require the use of present on admission indicator for PA expectations all reportable diagnosis on acute inpatient facility claims. If the present on admission indicator is missing from the claim, it will be returned without the payment. PO exception. Of course, we do have the PO exception rule. Based on the most recent update in October 2023, there are approximately 38,000 diagnosis codes exempt from the PO indicator reporting. For these specific diagnoses, you can submit claims without including the PO indicator and everything will be in compliance. Rest assured, you can access the list of these exempt codes on the CMS website. You will find the link in the description below for your reference. Furthermore, some facilities are exempt from the requirement to the report to the PO indicator. The PO indicator is a provision within the inpatient prospective payment system, so exclusively applies to the facilities that receive payment under the IPPS model. Suppose a facility is compensated through different reimbursement methods such as critical access hospital, cancer hospital, or VA hospital. In that case, they are not obligated to include the PO indicator when billing Medicare. However, it's essential to note that Maryland hospitals have unique status. They are still required to report the present on admission indicator to Medicare, but this reporting has no impact on their payment. A crucial note regarding these exempted facilities: regarding the affected hospital, the requirement for the present on admission indicator and the hospital acquired condition payment provision exclusively pertain to inpatient prospective payment system hospitals. Currently, the following hospitals are exempt from the reporting the PO indicator and the hospital acquired condition payment provision. Below are the list of affected hospital: critical access hospitals, long-term care hospitals, Maryland Weaver Hospital, Cancer Hospital, children inpatient facilities, religious non-medical healthcare institution, inpatient psychiatric hospitals, inpatient rehabilitation facilities, Veteran Administration Department of Defense Hospital. Maryland Weaver Hospital must report the P indicator on all claims. It is important to note that even if a hospital is not obligated to report the POA indicator, it doesn't necessarily mean that they won't do it voluntarily. The use of PO indicator has evolved since their introduction, and today they serve various purposes beyond the billing. They are employed in the quality review, financial planning, resource utilization assessment, or they may be even mandated by state regulations. The key takeaway here is that no matter type of facility an inpatient coder is working for, or PO indicator remains same and have wide range of applications. So what are the PO indicator options? What can we choose from? So below is a list of PO indicator. Provider must report one of 5 indicators. Y or yes means that the diagnosis was present at the time of inpatient admission. CMS will pay the CC, MCC, DRG those selected hospital acquired condition coded as a Y for the PO indicator. PO indicator N marks diagnoses that were not present at the time of patient admission but happened during the hospitalization. These conditions might result in the payment penalties. CMS will not pay the CC, MCC, DRG for those selected hospital acquired conditions that are coded as a N for the PO indicator. We have U for the situation where the documentation is insufficient to decide whether the condition was present on admission or not. But it should be rarely used, not only because it can result in the financial loss to facility, but also because it might signal non-compliance with the documentation and patient care. We need to query the provider if possible, or otherwise CMS will not pay the CC, MCC, DRG for those selected hospital acquired conditions that are coded as a U PO indicator. PO indicator W. This is for the case where it is clinically impossible to tell whether the condition was present already on admission or not. CMS will pay the CC, MCC, DRG for those selected hospital acquired conditions that are coded as a W for the PO indicator. And the next one is PO indicator 1 on electronic claims or blank for paper claims. Finally, it comes to the PO indicator using 1 or leaving the field blank signifies that the assigned ICD-10 CM code is exempt from the PO reporting. This exemption is typically applied when a code describes conditions that are either unrelated to the reason for seeking healthcare service or are constantly present upon admission. It is important to note that CMS will not reimburse the CC, MCC or DRG for selected hospital acquired condition that have PO indicator 1. Additionally, the PO indicator should not be used for any code on the hack list. For a comprehensive list of codes on the PO exempt list, please refer to official guidelines for ICD-10 CM. Example for the POA: if the pneumonia was identified as a pre-existing condition, meaning it was present when the patient was admitted, the coder would use PO indicator to specify the pneumonia was present on admission. If the pneumonia developed after the patient admission, the coder would use a PO indicator to specify that the pneumonia was not present N, indicating that it was not present on admission and was a hospital acquired condition. PO indicator U undetermined. A patient is admitted to the hospital with abdominal pain and the medical record does not clearly indicate whether the pain was present at the time of admission. In this case, the medical coder might use a PO indicator U to signify that it's undetermined. If the abdominal pain was present on admission, W, it means that clinically undetermined. Example: a patient is admitted with the symptoms of respiratory infection, but the medical documentation is not definitive in determining whether the infection was present at the time of admission or developed after admission. In this scenario, WPO indicator might be employed to denote that the status of the respiratory infection is clinically undetermined at the time of admission. As you can observe, applying PO indicator may seem relatively simple, but it holds a critical significance. Incorrect application of this indicator could potentially lead to the financial loss for the healthcare facility. For instance, let's consider a scenario involving a patient admitted as an inpatient for the treatment of pressure ulcer, the PO indicator significance become evident in the following manner. If we accurately label it is as a present on admission, or if the documentation doesn't conclusively determine its present, Medicare will cover both the diagnosis and the associated treatment. However, if we incorrectly code as a not present or admission, indicate that it is undetermined from the documentation, neither the diagnosis nor its treatment will be eligible for the reimbursement. A single coding mistake could result in reclassifying or previously payable diagnosis as a non-payable, critical impact of the PO indicators. These indicators help provide clarity about the timing of specific condition, which is essential for accurate medical coding, billing, and tracking hospital acquired conditions. In my next video, I am going to discuss more details about the hospital acquired diagnosis. Thank you for being here with me today. I will see you soon in the next video. Thank you so much.